Kate Delaney, NBC Sports Radio, NBCSportsRadio.com. Always pleased to be joined on this show by Dr. Philip Stieg. He's a world-renowned neurosurgeon, and he is the chairman and founder of Weill Cornell Brain and Spine Center. And there is always so much to talk about when we talk about the brain, especially related to sports, but just in general as well. Hey, Dr. Stieg, thanks so much for joining us.
Thanks so much for inviting me, and happy Mother's Day.
Hey, thank you. I appreciate that. Now, we didn't interrupt your tennis game or anything, right?
No, just Mother's Day dinner.
Oh, that's okay. You had to sneak out of the dinner. I love that. So a couple of things. One, this kid was a defensive back, and he had a concussion at a game, and a couple weeks later, a doctor cleared him to start practicing again. But he had also passed the test, and so they felt like, okay, we had the test, and he passed it, and that's why the story was about, are there flaws in the concussion test? I guess, is anything ever 100%? And I'm sure you're going to tell me, Doc, it's not, right?
In medicine, we never say never, and we never say always. So it's, again, I don't know whether a scan was obtained on this young man. Was there some other underlying lesion that was there that we don't know about? So I don't want to steer the listener in the wrong direction. I think that we, certainly at the professional level, and I know that it's getting better both at the college and high school levels and even the Pee-wee levels, that we're getting much better at assessing and protecting players from getting hurt in subsequent events.
Yeah, there you go. And that's the answer, and that's the exciting part medicine-wise, is that this is happening now on a very big level, right?
Absolutely, across the board. I think there are some sports that still need to be more aggressive. I think that the mixed martial arts sport is very concerning to me. Hockey is coming along. Certainly in college lacrosse and soccer, they're getting better, but there's still room for improvement in terms of monitoring and following the students.
It's interesting, too, when we talk about the brain and we talk about sports, and, we try to make comparisons as we take something like the brain, very complex. Certainly don't have to tell you that. And I wonder about this because I just had this conversation last week with a neurosurgeon that was, in California, that was actually talking to a friend of mine about something that you talk about. What happens to the brain when you meditate? Does that, what ultimately, for everybody out there, because I know there's a lot of sports people who, whether they're weekend warriors like you and I are, or whether they're professionals, or whether they're kids, I've heard lately that it's great to really train your brain, and it helps when you meditate. What happens to the brain when you meditate going in a different direction?
Well, I'm a strong advocate of meditation or mindfulness training or yoga, areas like that. You'll actually see a lot of the professional athletes with their headphones on. It's not really meditation, but it's an attempt to focus one's brain. And with mindfulness activities or yoga, there is a focus that one attempts to achieve. You try to concentrate on stillness. You concentrate on your heartbeat, on your breathing rate, or a piece of art on the wall, and then you try to completely unwind your body so that you almost mindfully become disassociated from your body. And there is some new literature that suggests that this is extremely beneficial, not only emotionally and intellectually for the brain, but there is now some MRI data that suggests that there's thickening of the what we call the cortical mantle. It's the thickening of the brain cortex. And there's also thickening of the projection fibers throughout the brain, suggesting that repeated activities of yoga and mindfulness are very positive for your brain health. And that's one of the things that people are starting to talk about when it comes to preventing the onset of Alzheimer's and dementia.
Yeah, and it is like sports in learning and perfecting a sport, it would be the same thing in trying to get a healthier brain, right? You have to train it.
Absolutely. I mean, you don't just sit down and say, okay, today I'm going to meditate. It's a skill set that one has to learn. I would suggest that one goes to a class, and you can take about 10 classes, and then it really just becomes independent. You can be at home, and ideally, if you can take 10 minutes, or ideally it would be 20 minutes twice a day, it is extremely beneficial.
Yeah, and I wonder, it'd be interesting to know this, and it would take a giant study, I think, and across all the sports. But I know that a lot of athletes are doing that. A lot of athletes are meditating, are using that as forms of relaxation. You talked about the headphones and the music and whatnot. So I think we may see a shift toward that, Doc, to relax some of these athletes.
Oh, absolutely. And it's like anything else, repeated activities in sports. We talk about muscle memory. A similar thing happens with our brains as we learn how to memorize a sequence of events. Your brain becomes more proficient at that.
Yeah, absolutely. Dr. Stieg, apologize to your family for us. Happy Mother's Day to everybody in your family, and thank you for coming on NBC Sports Radio.
Kate, so nice to talk to you.
Always. He is such a smart guy.